Hi, my name is Jean. I'm going to be your student nurse today. Is it okay if I do a quick head to toe assessment on you?
Yes.
Okay, can you state your name?
Michaela.
And what is your birthday?
10/7/99.
Alright, so that makes you how old?
21.
Alright, can you state your race and your sex?
Caucasian female.
Okay, and what's your apparent state of health? Are you like healthy?
I would say healthy.
Okay, that's good. Can you state your height and weight?
5'7", 140.
Okay, so that makes you have a BMI of 22, so you are healthy. Do you have any complaints today?
No, I'm good. Just here for an assessment.
Okay, I can see you're dressed well, your hygiene's good, your grooming's good, your hair's all combed out, we're all okay there. So your demeanor, you're cooperative. Your affect is animated. You're here talking to me, so we're all good. Your thought process is logical, relevant, and oriented. Because I see you came prepared for it. Your speech is clear. And can you state your name again?
Michaela.
And where are you?
My house.
All right, and what time of day is it?
It's like late afternoon.
Okay, and do you know why we're here?
For an assessment.
Okay, so you are learn oriented times 4. Are you able to tell me who the president was before Trump?
Obama.
Can you state my name? If I were to say an apple a day keeps a doctor away, what does that mean?
It means that I ate an apple, that I will be healthy.
Okay, and if it were snowing outside, what would you put on?
Heavy coat.
Okay, so your judgment is good. We're going to go ahead and do some vital signs. So this thermometer here, we're going to go ahead and do it orally. Yeah, take your mask off underneath your tongue. All right, 96.2, that is perfect. No fever today. All right, can we go ahead and do your pulse?
Yes.
All right, I'm going to use this as my clock. If you could just rest your arm up here. Yep, this one's a little bit better. All right, heart rate is 82. And just do some respirations. If we could just keep it right there. All right, and respirations are 16, both within normal limits. We're gonna go ahead and do your blood pressure right now. And then what is your blood pressure like? How does it normally run?
It's usually around normal, like 170/80.
Okay, could we
usually runs on the lower.
just do the other arm? So
Oh yeah, it's probably
up
easier.
here. Yep. Roll up your sleeve as far as possible. Or you can leave the white one down.
Leave the white one down.
Yeah, just so we have a smooth area, and just pull up the green one. All right, so we're gonna go ahead and do this right here. Okay. I have this resting right here. Have this closed all the way off. Now, can I have you straighten out your arm? Keep it right there. Go ahead and relax. I'm gonna go ahead and get started. All right, I got 112/72, which is really good. All right, let that go all out. Go ahead and take this off. Get this off of you. All right, and then do you have any pain today?
I do not.
All right, perfect. Okay, now we're gonna move on. We're gonna start with your head. So I'm gonna see it's symmetric. The shape is appropriate. That you have no signs of trauma on your head. I'm gonna just check and make sure your hair is attached to your scalp. Yep, all good. No lesions or bumps on your scalp either. So everything with your head is okay. So we're gonna do your eyes. Could you just look at my finger? Okay, they're aligned. Prominence, they're not sunken in. They're not protruding. So prominence is appropriate. Now we're going to do perla. So if you look at the ridge of my nose, I'm going to shine the light in your eyes. All right, good. We're going to test for accommodation. So I want you to turn your head slightly. I'm going to have you look at the wall back there. Look at the wall. Now look at my pen light. All right, accommodation is good. So we're going to do the EOMs. So just move your eyes, not your head. All right, that's intact. So your ears, they are symmetrical. Negative for lesions or bumps. No lumps either. I'm going to look inside your ears. So I'm going to pull up, out, and back. I'm going to shine light into them. All right, color's good. And check the other one. All right, we're all good there. And then have you been able to hear me okay? Okay, so your gross hearing is intact. So your nose, I'm going to ask, do you have any congestion today? All right, you can pull your mask down. I'm going to look and see the outside of your nose is symmetrical. I'm just going to look up inside. Symmetrical. So do you have any drainage? Okay, none that I saw either.
Just some allergies.
Okay. And then breathing. Can you breathe in through your nose? Okay. Good. And then are you able to smell normally? Okay. Good. So now we're going to do look at your throat. So you can pull down your mask again. I want you to open wide. And look at the back of your throat. Good. Also lift up your tongue. What's that part? Teeth are intact. Doesn't look like you're missing any. They're not loose. So your gag reflex, is that normal for you? Okay. All right. Can you swallow? Okay. If you could just pull your mask off of one side so I can see your whole throat. Swallow again. All right. Good swallow. I'm going to check your trachea. Midline, no shifting. Lymph nodes. So we're going to do preauricular, postauricular, occipital, tonsillar, submandibular, submental. We're going to do superficial cervical, post-cervical, deep cervical, and subclavicular. Did you feel any pain or tenderness when I was doing that? Okay, good. They were non-palpable, which is really good. Now we're going to look at your carotid. I'm going to do one at a time. Other side. All right. Now what I'm going to have you do is I'm going to listen, and you're going to breathe in and hold your breath. I'm going to listen, okay? All right, breathe in and hold. All right, I'm going to do the same thing for the other side. Breathe in and hold. All right, you're negative for breathe. And then next is your skin. So your skin tone is appropriate. Just gonna look right here on your neck. Moisture is good, texture is smooth. Turgor, I'm gonna just pinch a little bit here on your neck. Snaps back into place. And as far as I can see, you're negative for lesions. Okay, so now we're going to do the cardiac assessment on you. So I have you laying down on our makeshift bed. I'm going to look for heaves and lifts, pulsations, negative. So now I'm going to feel for any pulsations and throws. We're going to start right here, second intercostal with the aortic, negative, pulmonic, negative for throws, Erb's point, negative for pulsations, negative for throws, fourth intercostal, negative. We're going to go down to tricuspid. Sorry, hit you in the face. Negative. Then mitral. We have a faint tap. It is regular with the vitals. All right, so we're all good there. So, and then right here with the mitral is the point of maximal intensity. Right there at the mitral spot. So now I'm going to go ahead and listen 3 times. So first time through, I'm going to do it with my diaphragm. Just sound for the appropriate relation between S1 and S2. Go aortic, pulmonic, Erb's point, fourth intercostal, tricuspid, baby steps over to mitral. And mitral, fifth intercostal. All right, so now we're going to go through the second time, and we're going to listen for high pitch extra sounds starting down here at the mitral. Inch across to tricuspid. The fourth intercostal. Erb's point. Pulmonic, aortic. Going to flip it and listen for low pitch sounds with the bow. Aortic, pulmonic, Erb's point, fourth intercostal, tricuspid, and mitral. All right, we had no extra heart sounds, so now I'm just going to percuss the precordium across the second intercostal space. So we're going to feel here. Resonance, resonance, dull, dull, resonance. All right, so size is how it should be. And that is it for our midterm return demonstration. So now we're going to move on to lungs and thorax. I'm going to start on the anterior side. I'm just going to inspect right here. All right, so we have appropriate skin tone, color, temperature, moisture. Let's go turgor now, pinch. All right, we're all good. Texture is good. Negative for lesions. Your flesh tone was appropriate, warm, moist. Just reading everything over again. So now we're going to go on to your thorax. So your size is appropriate, the shape is appropriate, symmetrical. Can you just give me some shrugs? All right, good. Now I'm going to palpate your clavicle and sternum. All right, everything's intact. Now I'm going to feel your shoulders. Can you shrug your shoulders for me? All right, good. Now I'm going to do some excursions. So I'm going to place my hands at the base of the lungs on the front and have you take a deep breath. All right, excursion is good. Now lateral, I'm just going to have you turn to the side. I'm going to check right here. Just look negative for lesions, appropriate skin tone. All right, now posterior, if I could just have you turn around for the sake of the camera. Inspect for color and lesions. Color is appropriate, negative for lesions. Now I'm going to feel your scapula. All right, those are good and symmetrical. Now we're going to do the spine placements. We're going to start up here with cervical. We're going to move down into thoracic. Lumbar. And sacral. All right. We're all good there. Your spine is straight. I'm going to place my hands at the base of your lungs in the back and have you take a deep breath again. All right. That's good. I'm going to measure the size of your thorax. I'm going to do, it's like a Pledge of Allegiance right here for you. I'm going to move my hands to be right here. And that is half the transverse diameter. You have no barrel chest. That's good. Curvature of spine. I'm just going to have you turn just a little bit this way so we can see it. We have concave up here. Convex. Concave right here. And convex again. So you have the appropriate S curvature. Now I'm going to have you turn to the front again so we can listen a little bit. All right, I'm going to have you take deep breaths through your mouth, but no quicker than normal. If you could look that way for me. Just with your head. Yeah. All right, deep breath. All right, lung sounds anteriorly are clear and symmetrical. Yeah. Okay, so now we're going to listen on the posterior. So can I have you give yourself a hug? All right, so we're going to go 1. 1. 2. 2. 3. 3. 4. 4. 5. 5. I'm going to have you go over here 6. Big deep breaths. 6. And 7. All right, lung sounds on the posterior are clear and symmetrical. All right, so now we're going to be moving on to the abdomen. So is it okay if I just lift your shirt up a little bit?
Mm-hmm.
Okay, so we're going to lift it up. All right, so your abdomen is non-distended. So we're going to go ahead and listen for bowel sounds right now. Going to listen in the upper right quadrant. All right, I heard 10 bowel sounds, which is perfectly normal. So now we are going to percuss around the abdomen. I will not go lower than the waistline though. Go right here. Try to lift that up a little bit. Right here. What's wrong? It's it tickles. Okay, so percussion is good. We hear some timpani. Tenderness. Do we have any tenderness down in here?
Mm-mm.
All right, so we're going to go down to the waistline. All right, so you're negative for any lumps or lesions on your abdomen. I did not feel any enlarged organs. Bladder distension, we would normally check, but have you had any pain?
Mm-mm.
Okay. All right, sounds good. Okay, so we're going to be moving on to the musculoskeletal part of the assessment. So do you have any joint pain?
I do not.
All right, now I'm just going to look for deformities. We're going to go towards the joints, knees, ankles look good. Can you hold out your arms? Going to look at your elbows. Good. Shoulders, good. No deformities, no range of motion. Do you have like full range of motion in your arms? All right, about your legs. All right, looks good to me. Crepitus, do you have any cracking or pops in your joints?
Mm-mm.
Okay, sounds good. Now we're going to move on to the extremities. So I'm just going to roll up your pant leg. Look for the color, temperature on both. Appropriate. So we're going to do up here too on your arms. We're going to roll up your sleeves a little bit. And look for color, appropriate. Temperature is warm. So now pulses, I'm going to feel your radial pulses. Those are strong and symmetrical. So 2 plus. All right, I'm going to move down to your posterior tibial pulses. And feel this, it's right here. All right, those are strong and symmetrical. Now your dorsalis pedis pulses. Strong and symmetrical. So all your pulses are good. And we're going to check capillary refills. If you could just hold out your hands. You do have nail polish on, so we'll be looking at the tips of your fingers for blanching. First return. Good. Do every other finger. Good. We're going to move on to toes. Do every other toe. Good. 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 Every other toe. Good. Brisk capillary refill. Now, edema, I'm going to look at your bony prominences like your ankles. See no edema around your ankles, none on your feet, on your arms, none around your bony prominences like your wrist, your elbows, or your shoulders. So negative for edema. Then we're going to do neurological. I'm going to have you grip my fingers. All right, now don't let me pull you. Don't let me push against you. All right, so I'm going to do that same thing with your feet. You don't have to grip them. That'd be pretty awkward. Okay, don't let me pull you. Don't let me push you. All right. Good, now can I have you stand up and just walk a little bit? I will follow you. Check coordination. All right. Good coordination. Now sensations, are you able to distinguish between hot and cold sensations on your extremities?
Yes.
Okay, perfect. Now reflexes, I'm going to do your bicep reflex. So if you could just roll up your sleeve, I'm going to feel right here with my thumb. Have you flex? All right, feel it down in there for the tendon. Okay, relax. Relax your hand on your thigh. Okay. They're there. Same thing with this. Feel the intercubital fossa. Flex. Feel down there for the tendon. Relax. All right. They're diminished, but they're there. So we're going to do your patellar. So just keep your legs as relaxed as possible. I'm going to go ahead and use this. I'm going to hit your knee. Oh. Actually got one. All right. All right, this one's a little weaker, but all right, we got it. All right, now one last part. Can you tell me what my name is?
Jean.
Okay, we're all done.